Good evening, welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Edo government insists on plans to make vaccination compulsory requirements for access to public places, worship centers, among others. Enugu State take delivery of more vaccines for the second phase of the ongoing inoculation drive. And U.S. plans COVID-19 booster shots for adults beginning at least 6 months after full vaccination. And as the third wave of COVID-19 pandemic continues to rage around the world, Nigeria has recorded 7 deaths, raising the death toll to 2,288. The NCDC announced 637 new infections across 18 states, and the FCT active cases now stand at 17,210. Here's more on the virus update.
The latest data from the Nigeria Center for Disease Control shows that the daily COVID-19 infections in the last 24 hours stands at 637 amid the spread of the Delta variant in the country. The latest figures were reported from 18 states and the FCT, indicating a drop from the figures reported earlier. Lagos topped the chart with 322 cases, followed by Rivers with 70 infections. 54 cases were recorded in Edo. 34 cases were reported in Delta. Akwa Ibom and Kwara State had 31 cases each, while 29 cases were reported in the FCT. 17 cases were registered in Ekiti. Ogun had 14 cases, Osun reported 10, Kebbi 8, Cross River 5, while Plateau and Taraba registered 3 cases each. Other states include Kaduna and Bayelsa with 2 cases each, while Benue, Enugu and Kano reported 1 case each. There were 0 cases reported from Gombe, Nasarawa, Oyo, Sokoto and Zamfara states. The overall count of confirmed cases in Nigeria now stands at 188,880. 347 people have been discharged in the last 24 hours, increasing the total number of recoveries to 169,382. Lagos, Rivers, Akwa Ibom and Oyo account for states with the highest number of cases currently on admission, while some northern states have the lowest number of hospital admissions. The NCDC also reported 7 additional deaths from COVID-19 complications in the last 24 hours, raising the fatality toll to 2,288. Presently, there are more than 17,000 active cases in Nigeria, while over 2.7 million samples have been tested so far. In Africa, there are more than 7.5 million confirmed cases and over 191,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 213 million, while close to 4.5 million deaths have been reported.
Reactions are trailing the recent comments by the governor of Edo State, Gordon Obaseki, during the flag-off of the second phase of the COVID-19 vaccination exercise in the state, where the governor suggested compulsory vaccination before members of the public can gain access to certain services or public buildings. Our correspondent, Osaze Obaze, spoke to some officials who harped on the importance of vaccination.
Governor Godwin Obaseki of Edo State lays out his cards and is not pulling any punches.
So from the second week of September, people may not be allowed to worship in churches and mosques without showing proof of their vaccination cards at the gates. Similarly, people will not be allowed to event centers for parties or receptions without showing proof of their vaccination cards at the gates of these occasions. We have made adequate arrangements with security to prevent anybody who does not have a vaccination card from accessing any of these events.
A legal expert in Benin City says the governor is still within legal ambit.
He has such powers pursuant to the provisions of the public health law and other laws, regulations in that behalf. They may be successful if the matter goes to court I concede that on the grounds that, oh yes, there's an overriding public interest.
The national president of the Nigerian Medical Association, during a courtesy visit of the association to the University of Benin Teaching Hospital, insists COVID-19 vaccination should be taken seriously.
Those who are eligible should be vaccinated, particularly those who are at increased risks of age and comorbidity. They should. I actually know that it is going to be like yellow card. Vaccination against COVID-19 will be like yellow card. If you don't have it, you do not move.
The chief medical director of UBTH, Professor Darlington Obaseki, believes the hospital can cope with the expected increase in the number of people coming for vaccination.
So we have a site, we are ready. We are going to spread it and we're going to control it because we are trying to create awareness, create demand, and you heard the governor speak the other day, so that when they come, we have enough vaccines for now and even enough to upscale if we exhaust these ones.
On post-vaccination reactions, the state's epidemiologist says they are expected and normal.
When you take a vaccine, your body reacts to it. That response, sometimes called AEFI, adverse event following immunization, is expected, is normal, and we can predict the symptoms.
The success of public health stands on a tripod. The government, the medical institutions and the practitioners, as well as the general public. Osazobaze Channels Television News.
Over in Enugu State, the government has received over 13,000 new doses of the AstraZeneca vaccine to commence the second phase of vaccination in the state before the end of the week, while it also awaits the delivery of the Moderna vaccine from the government. According to the Commissioner for Health, the state successfully completed the first phase and second second dose, and says that it burnt the empties to avoid fake production by criminals.
The first dose of the first phase and second dose of the first phase completed it completely, making sure that even the remnants of the vaccination process were effectively taken care of. So, as promised, we were all aware that the federal government received a lot of vaccines recently. The deployment of the vaccines to states has started. Enugu State has received some vaccines. I got a report of about 13,000 doses of vaccines, and we're expecting more vaccines. In fact, I am waiting for information as to whether the vaccines have arrived right now. And once we get that confirmation, the information will be made public to people to know that the vaccines have come. Then we have received vaccines. Vaccination, the second phase of the vaccination is about to start in Enugu. And with a confirmation of our receipt of vaccines, we will be flagging off the second phase of the vaccination in Enugu to the citizens of Enugu State to be able to effectively join the battle against this third wave of the COVID pandemic in Enugu State.
Meanwhile, the Osun State government flagged off another round of COVID-19 vaccination to keep the spread of the virus at bay. Speaking at the launch of the Moderna vaccine in Osogbo, the state capital, Governor Boyega Oyetola, represented by his deputy, spoke on the measures put in place, as well as the readiness of the administration to curtail the Delta variant.
We're happy that we have representatives of almost all sectors who are present, who we are using as part of our champions to go around to tell people that this virus is still with us and that people should still obey the protocols. So we continue training our health personnel on how to also help in advocacy and also combat the virus in case of anybody that is infected. We continue keeping our isolation centers and the ICUs so that we're sure that we can arrest any situation that happens.
We have data strain in Osun, we have data strain in Oyo, virtually everywhere. So one will not be, sadly enough, I'm sad to note that we have lost quite a good number of people, and that is essentially what this Delta variant does. The more reason why people have to continuously observe COVID-19 protocols. We want everybody to mask up. We want people to maintain social distancing, avoid large gatherings.
Well, long COVID, this is a long-lasting disorder that arises following infection with the SARS-CoV-2, the virus that causes COVID-19. Surveys of thousands of people have revealed an extensive list of symptoms such as fatigue, dry cough, headaches, among others. A team led by a neuroscientist at University College London who has long COVID, found 205 symptoms in a study of more than 3,500 people. And by the 6th month, most common symptoms were fatigue, post-extortional malaise, and cognitive dysfunction. According to the report, these symptoms fluctuate and people often go through phases, feeling better before relapsing. Well, for more on this is Dr. Yunusa Tahir. He's an immunovirologist, also public health clinician and case management lead for the University of Abuja Teaching Hospital, Gwagwalada. He joins us from our Abuja studio. Thank you for joining us on the program.
Thank you very much, Millicent. Nice.
All right, good to see you. Thank you. What is the underlying biology of long COVID?
Thank you very much. Long COVID is a phenomenon that is used to describe what we call a long-term effect of COVID-19, which is caused, of course, by a virus called SARS-CoV-2 in the human system. This simply means that an individual gets COVID, he gets treated, he gets cured, and then he goes about his normal duties, and suddenly he starts feeling about one or two, feelings about which are kind of like sequel to some of the resemblance of what the individual was feeling before he was maybe brought in or to the treatment center or being treated. So this is what we call long COVID. People should understand that this is not lungs, L-U-N-G, lungs. It's called long COVID, L-O-G, long COVID. And that is some of those effects that most patients actually have when they actually have COVID. There is a study that is currently going on, of which we are championing, trying to ask a lot of these patients that have gone through this system to ask them about the common symptoms they do feel. And not far from what the data you just read out just now. But in terms of African COVID, fatigue is the most common symptoms that most patients usually complain of, even after they have been treated of COVID. Yes, and how long does it stay? It stays for some time longer than necessary. You just
than when the person has
some
recovered.
People that have been treated. Yes, yeah. And you find that even up to about 9 months, 10 months, the individual is still calling us, asking us, telling us that this is how he feels and the rest. So that simply means that we need to actually get our acts together and then make sure, just like the way we've led as an example, trying to make sure that we have the various contacts of those patients that have been in the treatment center so that we can do what we call, or what we similarly call a follow-up mechanism on those individuals, because some of those symptoms like fatigue, like panic attacks, like individual just feeling and waking up and just remembering all those ordeal it feels about COVID before then. So these are some of those things that we do have.
Dr. Tahir, we need to go on a break, but when we return, we'll be asking you if you recognize it as a somewhat disability, which some people are saying it should be recognized as. We have more when we return. Welcome back. We've been speaking to Dr. Yunusa Tahir, an immunovirologist, on long COVID, long-lasting symptoms of COVID-19 even after recovery. Thank you for your patience. I'd like to ask your thoughts. Some say that long COVID needs to be recognized as a disability. Do you agree that this would help manage it?
I totally agree, because we don't actually think that COVID-19 is something that is going to go off all once. This disease is just with us. And we are talking about new variants coming up. And we have not seen the end of this. Maybe we'll even get to the end of the alphabet of alpha, delta, beta, and all those stuff. So it's going to be with us for some time. And it means that for those people, we have not finished what we call the management of the individual at the time at which the person gets seroconverted and the person gets converted to COVID negative and then he gets home. We need to do follow-up and the rest. Some of these complications and some of those things that comes out in those patients can be kind of life-threatening, can be a form of disability. So for me, I actually strongly believe that it should be labeled as a form of disability, because if we do that and recognize that, then a lot of emphasis will be placed on that, and that can now be brought into part of the clinical management, and then we can actually now advise patients and tell patients that, look, these are the things that you might feel, and you should report back as it is, because we always say health is about management, it's about the total, complete treatment of a patient, not just writing drugs and then the individual go. So this is a disability and is going to be with us, and we should recognize that as
for some time.
Mm.
Just as we wrap up, is there access to follow-up care for those with symptoms of long COVID in Nigeria at the moment?
Yes, there is what we call follow-up mechanism that's been established in some institutions to follow up some of these patients. But you must also, Millicent, you need to recognize the fact that individual patients who have that responsibility to actually call what we call those experts in the line of COVID to let them know that this is how I feel, this is what I feel, and that can now be looked at, and then we can. In the country currently, we, for instance, in our own institution, we sit down to follow up patients and then see how far it's been done. And I can rightly say, in most of those COVID centers, management centers in Abuja, in FCT, there's that follow-up mechanism, which is quite good. And I think this can all be recognized. I sometimes receive phone calls nearly almost about maybe to almost 10 patients in a day that have been treated to tell you one of those symptoms that they do feel and can sometimes be crippling, can actually be crippling in them.
All right, we'd like to thank you.
I strongly believe that.
All right, we appreciate your time on the program. Thank you so much, Dr. Yunus Tahir, an immunovirologist. Thank you for joining us on the program.
Thank you. It's a pleasure being here, Millicent. Always a pleasure. And we should thank you for keeping COVID-19 in the front burner. Yes.
Thank you very much. We appreciate that. Let's move away from Nigeria, where online learning in Dubai's private schools will soon end as the government mandates a complete return to in-person classes for students at all levels. The new directive, which comes into effect in October, will also see the return of assemblies, extracurricular activities, including sports and swimming. Our Dubai correspondent, Mayowa Adeguke, has the details.
New directives by the Dubai government to schools mandate a complete return to in-person classes starting from the 3rd of October.
I have a daughter of my own, and she has struggled I see she has struggled in her social skills. She doesn't understand that she can share. There are several other components of education which cannot really be obtained online. So I'm very excited that kids are going back.
In a 22-page guideline released this week, government says schools are to ensure students maintain a 1-meter distance, while children aged 6 and above are to wear masks at all times.
So all schools now will be making sure that they've updated all of their policies, and then any of the information is put across to children. Classrooms will be adapted to make sure that there's that meter apart. We had placements on the floor so children knew where they would stand. Just because schools have already been doing it, it's not going to be such a massive challenge. Obviously, it's just sheer numbers now, so they'll just have to look at ways in which to ensure that all of the government protocols are being met. And as schools have regular DHA, so the Dubai Health Authority, and KHDA visits, they do make sure that they're ensuring that all of the students are following the rules, wearing masks, and then keeping 1 metre apart.
Extracurricular activities, including swimming, sports lessons, school trips and camps, have also been reinstated.
Some students are not academic. They thrive on that kind of competitiveness that you have in sports. So I just think it's really great that those non-academic subjects, like maybe that some students lean towards, and now they'll have their chance to shine again.
Local authority says that although 96% of teaching staff and 70% of students have taken the jab against COVID, vaccination is not compulsory. Eligible school staff who do not wish to have the vaccine must submit a negative PCR test each week. Students, however, are not obliged to do the same. From Dubai in the United Arab Emirates, Mayowa Adegoke for Channels Television News.
Well, for more on the new directives for schools in Dubai, a pediatrician, Dr. Shola Fanira, joins us on the program from Dubai. Thank you for joining us on the program. I'd like to begin, as a doctor who manages children, are you happy with the announcement of the return of in-person classes for all students?
I am very pleased, actually, and thank you so much for having me this evening. A lot of my work that I do is with children with developmental disabilities or children that are not meeting the academic requirements for their age or for their grade. And I have found that a lot of kids have been at a disadvantage with e-learning because the parents are not well equipped to properly support their children. So the idea that children are now able to go back in person full time and receive the level of support that they require, I think that's invaluable. And the added fact that they now have the opportunity to socialize. I've seen increased cases of families worried if their child has autism because the children's social skills are not what is expected. Little kids don't have the opportunity to interact with others. So yeah, I think it's an amazing thing that the kids are going back to school now. But it's really important, though, to make sure that all the guidelines are appropriately followed and adhered to, because we are seeing increased numbers of COVID in children. And as you all know, the vaccine is only approved for children above the age of 12, although we do have the Sinopharm that is being recommended for children over the age of 3 years in Dubai.
Do you think that vaccination should be made compulsory, especially if there's a likelihood that you might have a student or a teacher who is unvaccinated and perhaps in the same room with those who are vaccinated?
It's going to be rather hard to make it compulsory for everybody to get vaccinated because there are people on medical grounds that cannot have the vaccine. So immunocompromised people, you have to be careful and speak with your oncologist before you decide to vaccinate the children. Or if you have any issues with clotting or any other, there are quite a number that might have concerns about vaccination. But the more we talk about vaccination, the more we help people understand that this is a life-saving measure, not only for the individual that is vaccinated, but also for the community as a whole. Then hopefully we'll get more uptake on people getting vaccinated as well. So vaccination has been around for a long time, and we know the kind of diseases we used to have in the last 50 years, 100 years, that we now have eliminated because of vaccines.
So vaccination on the one hand, you mentioned the need for a lot of caution to follow the rules, but looking at younger children and the non-pharmaceutical protocols, that won't be easy, would it?
It is a bit challenging, but it is something that we can still instill in children. The younger ones, the infants, yes, it's going to be difficult. It's going to be hard for you to tell a 2-year-old toddler that they have to sit within the mat. But if the adults around them are vaccinated, if we all follow the protocols that if your child is unwell, you keep them at home, then we significantly reduce the risk. And at the end of the day, it's going to be a case of cost benefit. What is the benefit on the development and the health of children of returning to school in a safe and appropriate manner compared to adults around them and people who are eligible for the vaccine, taking up the vaccine and thereby protecting these children? So it's going to to be a case of us all working hand in hand together to make sure that we're supporting not only the children who are my passion, but also the adults, because there are some adults that are at risk. If you get COVID, that puts you significantly at risk of severe complications of COVID.
We'd like to thank you for sharing your expertise with us, Dr. Shola Fanira, pediatrician, joining us from Dubai. Thanks again.
Thanks for having me.
The Indian government says it has so far administered more than 600 million doses of approved COVID-19 vaccines to stave off a third wave of infections in the country. Let's take a look at the update.
The global update continues in the United States, which administered more than 364.8 million COVID-19 vaccine doses as of Wednesday, and distributed over 430 million more, according to the U.S. Centers for Disease Control and Prevention. The CDC tally includes 2-dose vaccines from Moderna and Pfizer-BioNTech, as well as Johnson & Johnson's one-shot vaccine as of Wednesday. Health regulators could approve a third COVID-19 shot for adults beginning at least 6 months after full vaccination instead of the previously announced 8-month gap. The Japanese government has announced it will expand the COVID-19 state of emergency to Hokkaido, Miyagi, Gifu, Aichi, Mie, Shiga, Okayama and Hiroshima amid the country's latest resurgence of infections. Tokyo and 12 other prefectures have already been covered by the state of emergency. The measures will come into effect on Friday in the newly added 8 prefectures until September 12th in all areas under the state of emergency.
Take a look at our website at channelstv.com. It has the latest updates on the pandemic and several other stories, breaking news. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.